my name is Darlene. I am going to be your student nurse for today. Can you tell me your name and date of birth? Now I'm going to compare mom's ID band against baby's ID band to make sure that they are a match. I am going to provide the baby with a blanket to make sure baby is warm. Today I'm going to do a head-to-toe newborn assessment on your baby just to see how things are going since birth and make sure that all body systems are functioning appropriately. Washing hands, providing privacy. To begin, I am going to listen to the baby's apical pulse, which normally is between 120 to 160 beats per minute, as low as 100 if the baby is sleeping, and up to 180 if the baby is crying. Okay, after listening to baby's apical pulse for 1 minute, the apical pulse was 135, which is a normal finding, and it was regular and no heart murmurs was heard. Now I am going to count respirations for 1 full minute. Respirations should be between 30 and 60. After counting respirations, I noted that my baby's respirations were 45, which is a normal finding. There's no signs of respiratory distress. Um, the respirations were 45 and they were even. Um, some signs of respiratory distress for infants can be circumoral cyanosis, sternal retractions, reddening, or nasal flaring. Now I am going to listen to my baby lung sounds. Okay. And upon auscultating, lung fills are cleared to auscultation and all lung fills. Next, I am going to take my baby's auxiliary temperature. And a normal auxiliary temperature will be between 36.5 and 37.5 degrees Celsius. And my baby's auxiliary temperature was 37 degrees Celsius, which is a normal finding. I would also assess the fifth vital sign at this point using the NEM scale. So now I am going to move on to the actual newborn assessment, and I am going to assess the baby's posture and its movements to see how the baby is moving. And I will report that my baby is quiet and she is active and alert. Now I am going to assess the head, the anterior and posterior frontal. So I am going to fill, and upon filling, the anterior frontal is open, soft, and flat, and the suture line is open. And now I am going to work my hands down to the posterior, and the posterior frontal is soft and flat as well, and it is smaller than the anterior frontal. And that concludes the part for the head. Um, Sometimes when the baby is coming out, the baby can have a cephalohematoma um, because of how it came out. If the baby's head had hit something or it got stuck on something, and you will notice that one side of the head may be, it will be uneven. One side would be a little more swollen than the other. Now I am going to assess the abdomen for bowel sounds. Okay, and I determined that bowel sounds are present in all four quadrants. I am going to check the umbilical cord, and this is to make sure that I want to make sure that it is clamped tight and that the cord is drying. There are no signs and symptoms of infection, no redness, no swelling, no drainage. And next, I am going to check the genitalia. And for female, the labia majora is going to cover the clitoris, and um, it's going to cover the clitoris and the labia minora, and you may notice a white creamy discharge, which is a normal finding. And then when it comes to the male genitalia, you want to check for the meatus patency. That is important. You want to make sure that the meatus is at the tip of the penis, and you want to make sure that both testes are present. Okay? And after checking the genitals, now we are going to go and we are going to check for the baby's reflexes. One reflex we can check is with the glove finger, of course. You're going to put it by baby's mouth. Baby's mouth should open and you're going to touch the palate, and the baby should suck, and that's checking the sucking reflex. Next, we are going to check the rooting reflex, which is by touching or stroking the side of the baby's cheek. The baby should turn her head um, toward the side that you are touching. The next reflex that I am going to do is the Moro reflex, which that one is you are going to lift the baby up and you're going to allow the baby's head to drop 30 degrees. And after doing that, the baby's arms should flare out and extend, as well as the baby's legs, and the hands should fan out, and then everything should close back and come back to normal. The next reflex I am going to check is the grasping reflex, which we will do that by stroking the inside of the baby's hand, and the baby should close his hand and wrap it around your fingers. It should be a natural reflex. Next, we are going to check the baby's Babinski reflex, which that one you would check by stroking the sole of the foot. And as you stroke the sole of the foot, the big toe should move upward and the other toe should fan out. The next reflex that we are going to check is the stepping reflex. And the stepping reflex we would check by having the baby stand up. You will hold the baby on his feet and it will look like the baby is standing trying to walk. And that completes the assessment that we are going to do with the baby. And now I would like to direct my teaching toward the parents. So first, I would like to discuss safe sleep. With sleeping, we like to use the acronym, the ABCs. It is very important to make sure that A, the baby is in the crib alone, B, the baby is on its back, and C, that the baby is in a crib. It's important to make sure that the baby is alone in the crib because this reduces the chance of SIDS, which is sudden infant death syndrome, and it prevents suffocation. You want to make sure that there are no loose blankets. You want the baby to be nice and snug inside of the crib. When using the Bob syringe, before you use it, you want to make sure that you press the syringe in, and then you are going to suction the baby out as you slowly release the Bob. The next thing that I am going to talk about is the umbilical cord care. It is very important that the umbilical cord stays outside of the baby's diaper because when it's inside of the baby's diaper, it can become really moist. It's going to attract moisture, and that can be a risk for the baby getting an infection, and we don't want that. You also want to make sure that the umbilical cord is kept dry. So keep it outside of the diaper and make sure that it stays dry. Next, we are going to talk about feeding. Can you tell me how you plan to feed your baby? Will it be by bottle or breastfeed? Okay, you're going to best breastfeed. So with breastfeeding, you want to make sure that you feed the baby 8 to 12 times per day. Um, and you want to give a lag time of 5 to 20 minutes while the baby is eating. Um, this is just a standard guideline, but of course, you want to listen to your baby. And if the baby is showing you signs and symptoms that that she is hungry, you want to make sure that you go ahead and you breastfeed so that way she's feeding and she's not hungry. The next thing that we are going to talk about is the expected urine output within the first 24 hours. So within the first day to three, the baby is not going to urinate as much, which is normal. You'll notice that you'll just have 1 to 2 soil diapers, but by day four, the baby should be um, urinating approximately 6 times a day. So you should see at least 6 soil diapers. And as far as the stool, so since you are breastfeeding, you'll see about 4 stools per day, and the stools will be soft, seedy, and you may notice a sweet and sour odor to the stool, and it'll be in a mustard color. If your baby was receiving formula, you may notice that the baby would um, have bowel movements 1 to 2 times per day, and this is because formula is a little tougher for the baby's system to digest. So the baby isn't going to formulate stool as frequently, and these stools are going to be formed, and it will be a light brown or yellow color. Um, as far as the weight expected, the weight that's expected for the newborn to lose, the newborn is going to lose about 10% of its body weight within the first week of life. And this is because of the meconium, which is a stool passed by the newborn, and also the baby will lose some of extra, um, the extra cellular fluid. Okay. Some signs and symptoms that you will want to inform your nurse practitioner or your physician about immediately is if your baby has a constant fever. If you notice that like the baby is not eating, it's really hard for you to get your baby to eat, or the baby is just refusing to eat. If you notice any redness or swelling, especially around the umbilical area, because that can be a sign of an infection. Um, it is also important to notify your physician if you notice that your baby has a shrivel cry, because if the baby is crying shrivelly, it can be a sign of a neurological condition. So those are some things that you will want to report to your physician. And lastly, we are going to talk about, well, not lastly, but we are going to talk about some of the vaccines that your newborn is receiving or has already received. So the first one is erythromycin. It is an ointment that goes in the baby's eyes. And this is important for the baby to receive because it is going to prevent the baby from getting gonorrhea or um, chlamydia passed down from the mom. The next, medication that the newborn baby is going to receive is vitamin K. And the vitamin K is important because it helps the baby's blood clot. When the baby is first born, um, her blood is not able to clot on its own. So we give vitamin K to help with blood clotting so that we don't risk the chance of baby just bleeding. And the last vaccine that your newborn is going to get is a hepatitis B vaccine, and this is to prevent the baby from contracting hepatitis B. Something important that I want to show you is how to handle the baby if you notice that your baby is choking. So for this, I'm going to uncover the baby and I am going to just have a seat. And we are going to flip the baby over. You're going to hold the baby with your face down, prompt on your forearms, and you are going to give the baby 5 upward thrusts. Okay? And get you back form. The last thing that I am going to discuss is just general safety. So whenever the baby is in the crib, you just want to make sure everything is tucked away, that there aren't any loose blankets. You want to make sure that the baby is on its back. And skin to skin is very important for a baby. It allows your baby to get that one-on-one bonding time and to develop that emotional connection. And also, when the baby is cold, mom's chest automatically warms up to warm up the baby, or if the baby is too hot, mom's chest will automatically cool down to cool off the baby. So skin to skin is very, very important for a baby, and then it's also very helpful for mom as well. One thing that I did forget to mention earlier when I was doing my assessment is the notation of my baby's skin. And I would inspect my baby's skin from head to toe. And my baby's skin tone is pink throughout, normal for ethnicity. There is no evidence of any jaundice. There are no rashes, no lesions noted anywhere on baby's skin. And that concludes my assessment.